Hi everyone, I'm Kevin Infante, a graduate student at the University of Texas in Arlington. Today I will be presenting a snippet video about VTEs or venous thromboembolisms. A lot of us have learned of it in nursing school. We've heard about it at our workplaces. It's part of the Joint Commission core measures, which basically are national standards of care with the goal of improving patient outcomes. Today, we'll be learning more about basic pathophysiology of VTE, some background information about VTE, treatment options for VTE, as well as genetic, lifestyle, and environmental factors affecting VTE. What is a VTE or venous thromboembolism? They are basically clots that occur in the venous network of our body. There are two subtypes of VTE. First is called deep vein thrombosis, and the next one is called pulmonary embolism. DVTs or deep vein thrombosis occurs when a blood clot forms in a deep vein, usually in the lower leg, thigh, or pelvis. It could also occur in upper extremities of our body. A PE occurs when a clot breaks loose and travels through the bloodstream and lodges itself into the lungs. Some background information about VTE. It's one of the leading causes of mortality and morbidity worldwide and is often seen in people above 55 years of age. And it's a very costly disease. The estimated annual cost of it in the United States alone is somewhere between $3.5 billion to a little over $27 billion. Pathogenesis of VTEs is not completely understood. However, two mechanisms attempt to explain it. The first one is Virchow's triad, named after the German Rudolf Virchow, which is the father of modern pathology. Next is an immune component to thrombus formation. Virchow's triad is made up of three intersecting factors that lead to thrombosis once all three factors are set in place. First is hypercoagulability, which could be from blood clotting disorders or hyperviscosity of the blood. The other factor is hemodynamic stasis or turbulence, coming from interrupted blood flow or immobility. The third factor is endothelial dysfunction, which could come from vessel injury, from trauma, or surgery. The immune component to thrombus formation is also called immunothrombosis. Here, clots form through mechanisms that involve platelet activation that lead to fibrin, clotting factor, and coagulation pathway activation. Diagnostic algorithm for a patient suspected with VTE. Signs and symptoms of a DVT for a patient would include leg pain, redness, swelling, warmth, and tenderness. If a patient is suspected of a PE, they may exhibit dyspnea, chest pain, hemoptysis, syncope, tachycardia, and hypotension. Clinical decision is made based on the likelihood of VTE formation. If it's unlikely that the patient has VTE, D-dimer testing is done. If that becomes positive, then further testing is warranted. If there's a high likelihood that the patient has VTE, an ultrasound is performed to rule out DVT, and a CAT scan may be done to rule out the presence or absence of the clot. Treatment algorithm for VTE depends if the patient is stable or unstable, or if the patient can be managed on an outpatient or inpatient basis. Medications used to treat VTE include anticoagulants such as heparin, low molecular weight heparin, which thin the blood and reduce clot formation, thereby preventing pulmonary embolisms. Thrombolysis may need to be done, which includes breaking the clot through the use of streptokinase, urokinase, and TPA. If there is strict contraindication to anticoagulant use, the placement of an inferior vena cava filter will be needed. Let's look at some genetic, environment, and lifestyle factors that affect VTE. One study shows that African Americans have higher risk factors to VTE, hence have higher incidences of VTE compared to Caucasians. These risk factors include body weight, low family income, and higher factor 8 concentration. The annual incidence of VTE is higher in 6 European countries combined compared to the US. The VTE growth rate increases with Age. PE accounts for higher proportion in older people, and the lifetime estimates are higher among African Americans and obese individuals. Types of PE and VTE include provoked VTE, coming from trauma such as surgery, hospitalization, or immobilization. 30% are cancer-related, 50% are unprovoked. Other independent risk factors include increasing age, hospital or nursing home confinement, cancer, central line transvenous pacemaker placement, and recent pregnancy. If you have any questions, please feel free to reach out to me under our discussion boards, and I appreciate your constructive feedback. Here are my references for this presentation. Thanks again.